these exist for all forms of healthcare, dentistry, general practice, physiotherapy, medicine, because the benefit is they're collecting the data from the patients of the actual clinics. So it's going to be from the patients seeing osteopaths, rather than us setting up a very artificial research study in a university hospital, for example, where the patients that are going there aren't really like the patients we see in community-based practice in osteopathy. Yeah. So translating that research from a hospital-based university study to osteopathic practice can be quite difficult.
It sounds as though it's, we talk about RCTs being the gold standard of, well, double-blinded, placebo-controlled RCTs, being the gold standard in research. But of course, I've long sort of thought, and I don't think I'm alone in this, that saying if you take a piece of research and say, well, what happens if you manipulate this joint? That doesn't reflect what goes on in practice. Whereas this sounds like more of a pragmatic research where you say people come in and then they go out, did they get better? Exactly. Rather than what did you actually do in the treatment?
Exactly. RCTs have their place, but in reality, start to finish, you're talking 10 years and at least £1 million. And RCTs have their problems. They don't necessarily always reflect what's happening in clinical practice. Osteopathy is a very nuanced discipline. It has lots of subtleties. Osteopaths practice very differently. Even within one clinic, different osteopaths might practice differently. So trying to break down osteopathy into its component parts and then investigate those separately isn't ever really going to provide useful data to how an osteopath works in clinical practice.
Doesn't that make it equally difficult to do the research though? Because if you take a dozen clinics and you say, well, these clinics all treat children, you don't know that any of them treat in the same way. Some might be entirely craniosacral, some might do something else, visceral or soft tissue or even manipulation in some cases. Doesn't that mean that your research is not really going to be representative of what an osteopath, whatever that is, can do for children?
It depends what the purpose of the research is for. If we're looking at research to really try and help osteopaths understand how their treatment is affecting children, then yes, we need to be quite specific about what techniques they're doing to try and really evaluate the action of those. If we're trying to produce research to take to funding bodies and government to say, look, this is where you need to be spending your money on healthcare, they're just interested in the outcomes and whether people get better. They're less interested in how the patients got better. So we might just want to be looking at outcome measures of improvement over time. The exact nuances of what treatment was done is not going to be important in that kind of research. So it really depends on the focus.